3 out of 4 respondents in this survey, again, stated they would visit restaurants and bars with about the same frequency as they did before the Smoke-Free Workplace Act went into place. So 3/4 of the respondents, and that kind of fits with our data we saw, had no change in their interest or ability to visit those sites. While everything presented here today indicates that Ohio's coordinated public health efforts are having a positive impact on the health of our residents, I'd like to reiterate what I said at the start of this conference. These studies only represent initial findings on the impact of the law. Additional studies are currently underway, and we look forward to presenting you with their findings as soon as they are completed. One health issue that we hope to soon have more information about is how data relates to birth outcomes. We examined that data from these reports and did not find changes in the number of low birth weight babies or preterm births since this act was put in place. However, we'll continue to look at this area as more information comes in over time, since we have a very short period of time we've looked at so far. Also, there wasn't information available at the time of doing those particular studies on the exposure pregnant women had to secondhand smoke in the work environment, and we also don't know what portion of pregnant women work in restaurants or bars, so we need to address some of those factors and variables to be able to address some of the data that will come from those studies. Despite these challenges, these reports that we have here today are an excellent start, and we're looking forward to the future study results that come from several areas of analysis. We're working with Ohio State, we're working with CASE, and other health partners as we try to build this database. The executive summary of all this information, along with the full reports, are also available on our website at www.odh.ohio.gov. Now that you had a chance to hear from a number of different researchers, what I'd like to do is invite those researchers up to the front, and also other people that were involved in some other phases of our study from ODH, if you'd come on forward. And what we could do at this point would be to address questions that you might have regarding this information.
The data that deals with the hospital discharges, do we know whether or not those people, number one, are smokers? And can you explain how there could be such a dramatic change within one, I'm not sure exactly when this data would have been done, but between 1 and 2 months of when the law went into effect? And would that have been enough time to have any impact?
Answer that.
Well, in fact, we do not have information on the smoking status. It's not part of the Hospital Discharge Association information that we received from the Ohio Hospital Association. However, it is really remarkable to see this kind of drop. As you can see, we've noted the rates for May 2007, and that drop precipitated down to a low in September. We really don't know. Why it occurred. We have to assume that it's coincident to the introduction in the first few months of the ban. What the mechanism was that it occurred, we're really not sure.
Is this potentially a reflection of secondhand smoke? People that are no longer being exposed to secondhand smoke in bars?
No, that may be.
What do you think? What do you think might be the reasons?
All I can say is that this is consistent with the studies that have been done in other states. The Surgeon General's report that talked about the health consequences of involuntary smoking or secondhand smoke exposure, I believe delves a lot into the science behind that and maybe other resource.
And did they see that dramatic a drop within 1 to 2 months of the law?
The drops are immediate.
And the other thing I'll note anecdotally is that, because I was working in a large hospital system at the time this happened, is that this had a tremendous impact on how much people were smoking. Those that continued to smoke declined dramatically in the amount of smoking that they did because it wasn't as convenient. So one of our areas of focus at the Department of Health is that people will probably do things that are easy and readily available to them. They're more likely to do those things. If you make it less readily available, most likely their behaviors will change. And I believe the volume of smoking of individual smokers probably declined also as we made it less readily available. Other questions you may have?
Do your tax collection numbers, I mean, does that at all measure whether these businesses are still profitable? I mean, would their rising costs be a factor in that? Have you taken that into account?
What we took into account in the economic analysis was the sales tax liability, so that's essentially their sales. So it does represent the economics of those businesses. profitability data, because we aren't looking at individual businesses, it's a very complex analysis that has to do with management and hours and personnel and things that are beyond the scope of publicly available data. So certainly what we can say from the analysis that's been done here is to look at sales, which is considered to be a very excellent recommended objective outcome measure to assess the economic health of businesses. What we can say is that we didn't see a significant association in change of sales that was associated with the Ohio Smoke-Free Workplace Act. We can't speak to individual business data because those data aren't publicly available.
Dr. Wymyslo, in terms of health benefits, you mentioned that you're going to be looking at baby birth weight. What are some other areas that you might expect to see some benefit from this act that you might be looking at?
One obvious one that already has studies happening relates to asthma. So if you look at a particular medical illness that's likely to be impacted by smoking, asthma is a classic area of focus for us. So that information is just being determined. Other states have already taken some action in those areas to define the impact on asthma. We don't have that information yet, but that's being determined at this time. So look for that as another report that we'll be doing at a later time once we get that information in.